Hi, it's Mark from TLR. I'm here with Will Cito of InSync Physio and sports physiotherapists in Vancouver and North Burnaby. And we're going to talk about rock climbing injuries, specifically elbow injuries. What's the cause of this, Will?
Yeah, so first of all, like rock climbing injuries, with respect to elbow injuries, it's the second most common type of injuries that you see in rock climbing. And usually it's an overuse chronic type of injury. And so there are some sort of more acute, sort of traumatic type of injuries, where you get from like a fall or something like that. Those are far and few versus the chronic type of overuse ones. They can sometimes mimic what people also call golfer's elbow or tennis elbow. The other one is, I guess, is related to the shoulder, but it can also happen down closer to the elbow, is biceps. So depending on where the injury starts to happen or where you start to get problems and symptoms or whatnot, then you can start to get a biceps overuse injury. And that's the very common things to happen.
So what are the symptoms of an elbow injury from rock climbing?
Yeah, it can start off as the soreness that you get from a workout and you think that it's just, oh yeah, I had a hard workout. When you push it in the gym and you feel sort of that delayed onset muscle soreness. And then it continues and it doesn't go away. It can be really sort of a low-lying nagging thing too. And that's the thing that tricks most people. So it starts off as this low-lying like ache that's totally tolerable, and you end up like trying to climb through it and it just doesn't go away. And then a few days turns into a week, and a week turns into like 2 weeks and several weeks. And then quite often I'll see some climbers in here that end up like, yeah, it happened like 4 or 5 months. This has been going on for. And either it's not getting any better or it's getting worse. And so there's a few factors involved with that as well, in terms of, like what contributes to these type of injuries. And usually one of the biggest ones is just overtraining, overloading it, and not enough rest and recovery. So I'm actually treating a young rock climber right now, actually. He's only been climbing for 3 years, just coming on 3 years now this summer. And he's basically 5 days a week in the gym. That's a lot of training. And he's basically all high intensity. Every time he goes out, he gibbers. And so as a result, he's not really resting. And as a result, he's having such a big overload in his elbow and his forearms, and that's why he's getting problems. And actually it's been leading to some hand injuries too. So it kind of trickles down. So the other interesting thing about someone like this too is he's a student. He's a first year engineering student, and he's on the computer a lot. So now you're compounding all that climb training and all the things that you're doing, like already overloading it in terms of a physical activity perspective. And now you look at, okay, so let's say he has a job, or another person that has a job that's on the computer, same thing. Now you're all got all this repetitive strain happening in the forearm. So that's definitely a huge factor.
So is just getting the client history, is that their main form of diagnosis of this injury?
That's a big one initially, for sure. I mean, it automatically points me to the direction of what I'm thinking of and looking for. But obviously in the exam, I need to rule out other things. I need to rule out like there's any trauma and what else is going on, like, if there's other structures involved. Like, so if there is like stuff in the hand, for example, is it like a pulley or a tendon, or is it a ligament, or is it a tendon in the elbow? So it really helps us like kind of focus in on our objective exam when we take a really thorough history.
And once you've diagnosed what structure in the elbow or leading to the elbow is the problem, what kind of treatments options do you have?
Yeah, so usually like with golfer's elbow, it's similar to like on the inside of the elbow, where you can get a lot of overuse stuff happening around the points of where that muscle attaches just above the elbow there. And on the outside, which is the tennis elbow, and can be the exact same area on the upper part of the elbow. And so basically the first important thing, decrease the load. Like take the intensity down, take down like the aggravating factors. If work in school you cannot, then obviously you're looking at the loads of like, okay, let's look at your training. You're training 5 days a week. Let's get you in the gym And what are you doing? You're doing hard every day. Okay, let's get you in the gym 3 days a week. And instead of doing 3 hard days, let's just do like for the first week, let's just do easy stuff. And then we're only going to do a couple of days that are a little more moderate and then an easy day and build it back up. Because ultimately what we want to do, if there's any kind of an acute chronic type of swelling where there's sort of like, it's kind of low lying, but then you climb and you do something and it flares up a little bit, then that's what I mean when I say acute chronic, that you sort of have this like continual thing happening and it's there, but then now you aggravate it even more. So you got to settle down that acute stuff. So when it's swollen, you got to settle it down with basically the RICE principle for the first 48, 72 hours. So don't do much. Ice, compress, elevate. So that's important. And then once you got that going, and then you move into the, basically trying to get that healing phase. After 72 hours, up to a week is sort of that middle phase of that healing where it's laying down, the collagen. Collagen is the basic building blocks of the muscle, tendon, and soft tissue. And then there's what's called the final stage, which is called remodeling, which we want to really work at specific type of exercises. Now, that's not possible if you have a lot of other stuff going on where it's not even allowing you to activate that. So this starts to become, oh, well, what caused this? So we want to really look at, are we addressing the root cause of this first? And so that's how our treatment will be guided. Because if we can figure out what the root cause of the elbow issue, so maybe there's an issue in the neck. And actually with this individual, he has a neck issue. It doesn't hurt, but he did get in an accident. He had whiplash like when he was younger, but it doesn't give him any problems now, but he's really imbalanced. He doesn't have any neck complaints per se, other than the fact that, it's tight, normal tight. And so that can actually compromise a lot of what we call the normal movement patterns of that whole like shoulder, neck, elbow, forearm, hands, and fingers. So then what ends up happening is that movement pattern is now like totally off. And so we have to retrain that. And so part of looking at what we need to retrain that is we got to also look at what's imbalanced. So things are pulling, and we can get into a little bit more of that, especially when we look at the shoulder. But you get that in the elbow as well. So there's all these imbalances that happen all the way up.
And what sort of is the typical treatment time frame to get that retraining underway so they can get back going 5 days a week?
Yeah, so it depends on how ingrained chronically it is. If it's something that's just started and people come in right away, it will be relatively quicker. And I say this relatively quicker in sort of this quotations, like the retraining part will still take a good several weeks, a few months, and then ongoing sort of retraining it. And it's like, if you don't use it, you lose it. And so if it's more ingrained, this functional movement pattern, then the longer you got to retrain it. So I'm working with some climbers who have been working for quite a few years now, where we've been trying to help them retrain their functional patterns for over a year and a half. It gets better, but they climb hard and they forget to do their exercises and the recovery stuff sometimes. So we got to reset it. And so they come back into the clinic and see us. And we actually have quite a few rock climbing physiotherapists here that work at the clinics that can help with that too.
So if you have elbow pain and you're climbing, you need to get it looked after. It's not going to go away by itself, especially if you're climbing hard. Guys to see in Vancouver are InSync Physio. You can book online at insyncphysio.com for both locations in Vancouver. You can call them and book as well at 604-566-9716 or in North Burnaby, 604-298-4878. Get in there, get some help, get started on your retraining. Thanks, Will.